Hello everyone, my name is Diane Hayes and I'd like to welcome you to this webinar session on the reception role in a general practice. We acknowledge the Aboriginal and Torres Strait Islander people as the traditional owners of the lands. We wish to pay our respects to their elders past, present and emerging and acknowledge the important role Aboriginal and Torres Strait Islander people continue to play within our community. This webinar has been developed by Eastern Melbourne PHN on behalf of the Victorian and Tasmanian PHN Alliance, which is a collective platform for the 7 PHNs in Victoria and Tasmania. The webinar was made possible with funding support from the Australian Government Department of Health. The Commonwealth of Australia, Eastern Melbourne PHN and the participating Victorian and Tasmanian PHNs do not accept any legal responsibility for any injury, loss or damage suffered as a result of the use, reliance upon or interpretation of the information contained in this webinar. This webinar is to be used as a guide only. This presentation is designed to give reception and administration staff in general practice an overview of their role. The information in this session is useful for staff new to general practice to give them an idea of the range of responsibilities they may have, and it's also a good reminder for existing experienced staff regarding the many aspects of your role in the practice. In this session, we're going to cover a number of topics, including customer service and communication and their importance in the patient's health journey. We'll also discuss general practice accreditation and the many issues that arise in relation to accreditation which involve the reception staff. These include patient triage, infection prevention and control, vaccine and cold chain management, patient privacy and confidentiality of health information, communication with clinical staff, patient health records, recalls and reminders, and occupational health and safety. Even if your practice is not accredited, these issues are still valid, as what we discuss are accepted best practice as defined in the various guidelines and standards that govern our work in general practice. Finally, we'll talk about teamwork and how important it is for both clinical and non-clinical staff to work in a cooperative manner to ensure the best experience and outcome for patients accessing our health services. Practices vary enormously and your role in the practice will depend on a number of factors, including which other staff are employed. For example, a practice that employs practice nurses may tackle the issue of triage in a different way to a practice that doesn't employ nurses. Another example would be if you work in a practice that doesn't employ a practice manager, you may be required to take a greater role in activities like accreditation. Let's start with customer service. Customer service is not just about how you greet your patients, it's the service provided before, during and after a patient comes into your practice. A patient's experience of your service includes not only their experience at the practice but also telephone contact with the practice, as well as what they find when they access the practice website or use the online booking system. As the person answering the telephone or manning reception, you play a vital role in the patient's experience of the practice and their perception of the service provided. One of the key basics in customer service is to be friendly and helpful to your patients and work with them to satisfy their needs. Greeting patients with a smile is an important part of good customer service. It displays to the patients that they're welcome into the practice, and even if the patient's having a bad day, it's generally instinctive to smile back. The simple act of acknowledging the patient, even if you're busy or on the phone, is an important way to make the patient feel noticed and welcome. Think back to a time you were waiting for service and the person behind the counter seemed to do everything except look at you and acknowledge your presence. How did that make you feel? Setting a favourable tone early in the patient's experience in the practice, either when they telephone or when they present at reception, leaves an impression on the patient. If an incident arises and the patient is later unhappy with something that occurs, the fact that you've been friendly, attentive and helpful can assist you in those dealings with the patient. Another key aspect of the service you can provide in the practice is to know your organisation's product, services and billing system. It's incredibly important as nothing enhances a patient's confidence in your service as much as staff who are well informed about the full range of services provided by the practice. For example, if you sell privately funded vaccines, be aware of the stock on hand, their prices and how to bill and allocate payment. Let's not forget to consider our internet customers. Even though they're invisible to us, it's especially important that the practice's online profile is current and is giving patients all the information they require. Make sure you know what's on your practice's website and let whoever manages your website know if you notice information that's out of date or inaccurate. The same applies to your online appointment system. Test the system yourself so that you know how it operates, then you can advise and assist patients when necessary. Take a moment to think about your experience when you visited a medical centre. How were you greeted? How did they sound on the telephone? What was your first impression of the premises? How did you feel before, during and after your visit? To get an indication of the patient experience, it can be useful to sit in the waiting room of your practice as if you were a patient. What do you see and hear? We spoke earlier about acknowledging people at the front desk. The general rule for this is to try and acknowledge the patient within the first 30 seconds of arrival. If the patient is in front of you and the phone rings, ask if they don't mind you answering the phone and placing the caller on hold. Eye contact shows that you're ready to engage, that you care and are ready to help the patient. Where appropriate, use your interpersonal skills and engage the patient in conversation. It may be about the weather or their latest holiday, but remember to be sincere. Remember to maintain sensitivity to customers with specific needs and any cultural, family and individual differences. Best practice is to focus on one person at a time to ensure that person receives your full attention. If you're approached by a co-worker or a doctor whilst you're attending to a patient, excuse yourself and see whether your co-worker or the doctor can wait until you're finished with the patient. Or if the matter is urgent, ask another receptionist to attend to the patient you were dealing with, to free yourself to attend to the request. Don't try to answer the phone, bill another patient, check in a patient and speak with a co-worker and doctor at the same time. This is not good customer service and this is where mistakes can occur. Avoid having personal conversations with other staff and patients at the front reception area, and never discuss patients with other staff members while in the reception area. Ensure that you inform patients of waiting times and delays in their appointment time as soon as possible. Be aware of the patients in the waiting room by doing regular head checks. Your patients will appreciate it in the event that they've forgotten to check in on arrival, or if the patient isn't feeling well and you observe that they don't look well. The waiting area is your domain, so take charge of it. Know who's there and what they're there for. Having knowledge of the various products and services available make the patients feel confident in the information that you're providing. Get to know the services in your local area, such as the location of your nearest pathology collection centre, radiology, local hospitals, community health services, local pharmacy and other medical centres. It's also important that you know your own practice's location. What's the nearest intersection or streets in the event that you need to provide directions to new patients or even an ambulance. Those of you who've called an ambulance may have experienced being asked for your nearest major intersection. Reception staff also play an important role in identifying patients who would potentially be eligible to be part of other services that the practice provides, such as health assessments. Having knowledge of these services and having supportive resources to provide to patients when they arrive at the counter shows the patient that you're interested in their health. Another important part of customer service is feedback. Having strategies in place to receive feedback is part of quality improvement. This demonstrates to your patient that you value their opinion and that your organisation is interested in meeting the needs by delivering the highest possible service and care. There are a number of ways that feedback can be provided. Options include formal patient feedback surveys, and these are generally undertaken every 3 years as part of the accreditation process, or you may have a suggestion box in the waiting room, but most often feedback will occur in conversation between patients and a staff member. Feedback can also be provided through the practice's website. Remember to share any patient feedback you receive, whether it's good or bad, with the team. The practice manager or your GPs will be interested in what the patients are saying, and responding to feedback is an important way for practices to ensure the needs of patients are being met. Not all the feedback we receive will be positive, and whilst handling complaints may not be your direct role, being able to listen to patient issues and needs is important for good customer service. This is the first stage of complaint resolution, and it makes patients feel they're being heard and valued. Your practice should have policies and procedures regarding the handling of complaints, and as part of your role you should know what they are in order to assist patients if they wish to make a complaint. Most small issues can be resolved at the reception level, and practices often have policies that state that staff should try and resolve these small issues and only escalate them to the complaints officer if they're unable to achieve a resolution. Make sure you've read the complaints policy for your practice and that you know who the practice's nominated complaints officer is. patient complaint will often arise from a minor issue that's not been dealt with at the time. If you pay attention to what's happening in your waiting room, you can often hear issues that may lead to a complaint. Is someone looking increasingly agitated? Are they staring at you or pacing in the waiting area? Speak to this patient saying something like, "I know you've been waiting a while, you're next in with the doctor," maybe enough to calm the situation. Many practices have a rule to acknowledge any patient who's waited more than 20 minutes and let them know what's happening and that they haven't been forgotten. Letting patients know about waiting times when they arrive or even before they arrive, and giving them options such as coming back in 20 minutes, seeing another doctor or rescheduling gives back some control of the situation to the patient. Acknowledging a patient's complaint and working with them to find a solution can assist in diffusing a tense situation. Conflict is inevitable, and it's good to have some skills in conflict resolution. Remember that violent and aggressive behaviour towards staff is never okay and should not be tolerated. Your first priority is always your own safety, so make sure you know the practice's response to these situations. Does the practice have an alert or alarm system? Do you know how to use it? And what is your role if an alert sounds in another area of the practice? Some of the benefits of high quality customer service are improved customer satisfaction, creation of stronger customer loyalty, and increased staff job satisfaction. The definition of communication is getting a message from sender to receiver and that the message is interpreted correctly. Communication has not occurred if the message is not understood. There are many barriers to effective communication, and some of these include age, cultural background, socioeconomic status, past negative experience with healthcare providers, illness, disability, stress or worry. Having good questioning techniques assist in understanding customer needs. The slide on the screen outlines some of the components of a good communication strategy, and they include patience and attentiveness. Never rush the patient and don't get frustrated. Be confident when speaking with patients. Listen to what the patient is saying and think before you speak. Use clear communication. Try and avoid using jargon. Keep your messages clear, simple and concise. Ask the patient to repeat any instructions given so that you confirm that they've understood the message you're delivering. Using positive body language displays to the patient that you're interested in helping them with their needs. Only 10% of our communication is actual words. The other 90% is non-verbal, with 50% being body language and 40% being the tone of our voice. So be a whole body listener. This means not only listen, but use your body language to show you're listening. Time management. The aim with time management is to meet the patient's needs in an efficient manner. If you tell a patient that you'll get back to them, do so at the time specified. If passing on a message to another staff member, ensure that the message was received. This could be through the internal email or paper messages, and let the patient know who you're passing the message on to. A calming presence. Always try to maintain a calming presence under pressure. It's hard for someone to remain angry with you if you remain calm. Remember to smile as appropriate and make eye contact with the patient in a genuine, sincere manner. If a patient is anxious or panicky, try and remain calm and try not to display your own anxiety. Be confident in dealing with these situations, or if needed, pass the patient on to another staff member who may be able to assist. You can't help a patient if you're feeling anxious yourself. Empathy is described as the ability to understand and share the feelings of another person. For health professionals, this is something that's very important as we deal with person-to-person contact each day. Empathy includes the ability of a person to convey a feeling of trust. The patient needs to trust that the receptionist fully understands the entire situation. Closing ability is the ability to end a conversation with the patient feeling they've been heard and their needs have been met. Even if you can't address or solve an issue, convey to the patient that you'll pass on to someone who can assist them. And finally, feedback. Being able to listen to, acknowledge and where appropriate, act on the feedback from patients is a vital part of communication with patients. Communication skills are also very important when it comes to dealing with telephone callers to the practice. Your caller will expect 3 things from you: that you'll treat them with respect, that you'll help them achieve the aim of their call, and that you won't waste their time. Practices generally have a standard telephone greeting, and one of your first priorities in the practice is to learn the practice's agreed way of answering the phone or greeting a patient at reception. It's good customer service when answering a call that at the very least you identify the practice and yourself. Many practices also include a general greeting, good morning or afternoon, Smith Street Medical Centre, this is Mary, how can I help you? The greeting should be consistent for all staff and be delivered in a pleasant manner that doesn't sound rushed or impatient. Practices often have a set standard number of rings in which receptionists should answer the phone. Make sure you have a pen and pad next to you to take down the name of the person you're speaking to and their phone number in the event you need to call them back. Never put a caller on hold unless the caller has said it's okay to do so. If placing a caller on hold to gather further information, explain this to the caller and avoid keeping them on hold for long periods. When you retrieve a caller on hold, always thank them for holding. Practices should have a policy on incoming calls and under what circumstances and for whom you're able to interrupt doctors during consultations. All receptionist staff should be aware of the policy. Familiarise yourself with the practice's triage policy and when it's appropriate to direct a caller to the clinical staff member or a more experienced receptionist. When dealing with rambling callers, use closed questions rather than open questions to enable you to control the conversation and help meet the patient's needs. For example, use questions such as, I have a 2 p.m. appointment with doctor, does that suit you? Rather than saying, what time would you like the appointment? Listening to abusive people on the phone is not in your job description. Practices will have a policy regarding terminating calls. If you need to terminate a call due to abusive language, one option may be to inform the person that you'll not tolerate the language, give 3 warnings that you will terminate the call. After the 3rd warning, inform the caller that you're going to terminate the call and hang up. It's important to document the incident in the patient's file as an adverse event or incident. Also inform the practice manager or the patient's GP. I recommend you familiarise yourself with the practice's policy on terminating calls. Finally, a few general tips for telephone communication. Don't use slang. Don't leave the patient uninformed. Remember confidentiality and be aware of what you say and who is listening in the waiting area. Don't sound tired or bored. Don't rush a caller and allow time for the patient to comprehend what you've said. Do give your full attention to each patient and don't be distracted by others or background noise. And always ensure you check the patient's details so that you're sure you know who you're speaking to. For those of you very new to general practice, accreditation is a voluntary process that approximately 80% of general practices in Australia undertake. The process requires practices to be assessed against the Royal Australian College of General Practitioners, or the RACGP 5th edition standards, by an independent third party at least every 3 years. Accreditation uses a peer review model where surveyors must be actively involved in general practice, including in the area of practice management, and where at least one of the visiting surveyors is a general practitioner. The RACGP states that achieving accreditation shows patients that your practice is committed to providing high quality, safe and effective care as determined by the general practice profession. Some of the areas of accreditation that impact your role as a receptionist are listed on the slide, and let's briefly discuss each of them. Triaging calls to determine urgency and ensure a time-critical appointment is a responsibility of the reception staff. This assists in allocating appointments safely and to alert clinical staff to people who may possibly have a serious medical condition requiring urgent attention. Receptionists are required to ask a series of questions to assess a patient's health status and determine the urgency of a situation. The practice should have a triage protocol in place and receptionists should be confident in asking the appropriate questions in order to gather information and allocate appointments accordingly based on urgency. Remember to listen to the patient and never rush them. It's often non-verbal cues that make a difference when triaging, especially over the telephone. On the screen now is one example of a tool practices can use to assist staff in the triage decision-making process. The Popguns tool was originally developed by the Dandenong Casey Division of General Practice, and this version is from 2012. You'll notice on this tool there are questions that staff should be asking of patients, lists of symptoms that are categorised into 6 categories, and then recommended actions which are divided into if the person's on the phone or if the person has presented to the front desk. Many practices use a tool like this as a basis for developing their own customised tool to ensure that the actions reflect the protocols of the practice. This customisation of any tool needs to be done by the clinical staff of the practice, so they're in agreement with the reception staff about what issues should be brought to their attention urgently. There's also a handbook that should be used in conjunction with this tool that provides some tips on how the patient can be managed while waiting for clinical assistance. Whilst this is a popular tool used by many general practices, it's now no longer available on the internet. The RACGP standards for general practice state that praxis staff must undergo training relevant to their role, and triage training is considered vital for practice staff. I strongly recommend doing formal triage training, especially if you're new to the receptionist role. You'll find a webinar on triage on the Victorian and Tasmanian PHN Alliance website. As you are often the first point of contact, you are at risk of exposure to infections from patients, as well as patients being at risk of exposure to any of your illnesses. It's therefore important to protect yourself and your patients by covering up any cuts, ensuring you're feeling well when you're at work, and maintaining good hand hygiene, which includes correct hand washing or use of alcohol-based hand rubs. Hand hygiene has been identified as the most effective way to prevent the spread of infections, and your practice should ensure that you have a good understanding of when and how hand hygiene should be undertaken, including before starting work, before eating, after using the toilet, after handling any pathology, after smoking, and before leaving the practice. Make sure your work area is set up with infection control in mind. Alcohol hand rub, tissues and a bin for disposal of used tissues should be available at the counter for patients and staff. A personal protective equipment kit should be available in the practice for staff to use in the event of a pandemic or major disease outbreak, and this kit will include face masks, gowns, gloves. Other personal protective equipment that should be located at reception at all times include non-sterile gloves, pathology bags, masks and disposable bowls for vomiting patients. In addition, there should be signage in the waiting area asking patients to practice good respiratory etiquette and to wash their hands. In certain circumstances, you may need to ask patients to wear a mask or practice social distancing, which is essentially placing patients at least 1 metre apart to assist with preventing the spread of infection. Think about your options for isolating patients that are potentially infectious. Some practices with space issues ask potentially infectious patients to wait in the car until the doctor's ready to see them. Know what your options are in your practice. Another important aspect of infection control includes the practice's spills kit. All practice staff should have access to a spills kit. This is used to safely clean up a potentially infectious spill like blood or vomit. Make sure you know where your spills kit is stored and have been trained in the safe cleaning and disposal of a potentially infectious spill. A spills kit will contain a range of personal protective equipment including eye protection, gloves, mask, an apron or a gown. Make sure you put these on prior to tackling any spill. General practices are required to be visibly clean, and even if the practice has contract cleaners, the reception staff often take some role in keeping the practice clean between visits from the cleaner. This may include cleaning the floor if someone's been tracking mud through the practice, emptying bins or ensuring supplies of hand wash and paper towel are adequate. Regularly wiping down of all surfaces, especially the reception desk and furniture in the reception area, can further prevent the spread of infection. Many practices have a supply of hard plastic toys for children, and the regular cleaning of these may be the responsibility of the reception staff. Practices should have a written cleaning schedule. Make sure you look at this and see what you're responsible for. One of the best ways to protect yourself against infectious agents is to be immunised. Practices are required to discuss the immunisation they recommend for staff at the commencement of employment and encourage all staff to be fully immunised, and this includes annual flu vaccination. In order for vaccines to be effective and to provide protection against disease, they need to be stored between 2 and 8 degrees Celsius. This includes during transport to the practice and during storage at the practice. Maintaining vaccines between 2 and 8 degrees Celsius is referred to as cold chain. A member of the practice's clinical team will be responsible for vaccine and cold chain management in the practice, and you must know who this person is. Whilst a member of the clinical team will be responsible for the overall vaccine and cold chain management, many of the tasks involved may be delegated to reception staff. These tasks may include checking, recording and resetting the vaccine refrigerator temperature, receiving vaccine deliveries from a courier, or enacting the practice's cold chain breach policy during a power failure or other cold chain breach. If your duties include checking and recording vaccine fridge temperatures, ensure that you've been trained in how to check the temperature, where to record the temperature and how to reset the thermometer. Vaccine deliveries arrive in the practice via couriers. It's crucial these deliveries are dealt with immediately. This may be managed by handing the delivery to the practice nurse, or in some practices this is a reception responsibility. All vaccine deliveries via a courier include a heat and cold monitor that will indicate whether the cold chain has been maintained during the delivery process. This needs to be checked before vaccines are placed in the vaccine fridge for use. Reception staff may also have a role if a cold chain breach occurs, and we'll discuss this in more detail on the next slide. If the heat and cold monitor in a vaccine delivery indicates that the cold chain has not been maintained, this is called a cold chain breach. A breach may also occur during a power failure or disruption, or if the vaccine fridge door has been inadvertently left open. Cold chain breaches must be investigated and acted upon immediately, and often happen after hours or on weekends where there are less staff to provide support and advice. Practices should have a vaccine and cold chain policy which outlines the procedure for staff to follow when checking and recording vaccine fridge temperatures, receipt of vaccines from couriers and cold chain breach procedures. Remember that even if a cold chain breach has occurred, you will still need to maintain these vaccines at between 2 and 8 degrees Celsius while the breach is investigated. Mark these vaccines as do not use and never dispose of vaccines unless advised to do so by the Department of Health and Human Services. Patients will also bring vaccines into the practice. These vaccines will need to be stored in the vaccine fridge whilst the patient is waiting to see the nurse or doctor. Vaccine and cold chain management is extremely important, and I recommend that all general practice staff review their practice policy annually, know where this information is stored in case you need to refer to it quickly, and undergo specific training on this topic. You'll find a webinar on vaccine and cold chain management on the Victorian and Tasmanian PHN Alliance website. When working in a medical practice, staff will come across private and confidential patient health information on a daily basis. Receptionists are bound by law to protect patient privacy and confidentiality and to ensure that all medical information is stored in a secure manner. Practices will generally ask staff to sign a confidentiality statement, and this will cover patient information and often business information about the practice that you may be privy to in the course of your employment. Confidentiality is often breached by carelessness rather than by deliberate action. Each practice will have their own policies and procedures on security of patient information and levels of access, though legislation will dictate some of these policies. Reception staff need to be aware of privacy legislation, which include the Privacy Act and the Australian Privacy Principles, which dictate what information we can collect, how we use and store that information, and in what circumstances this information can be shared. Be mindful of patient privacy when having discussions with patients at the desk or over the phone. If the content of the discussion is of a personal or private nature, consider doing it away from the waiting area. Reception staff need to ensure that information regarding patients, including messages to clinical staff, computer screens, correspondence, or even a patient's pathology, should not be either visible or accessible to anyone other than the relevant staff of the practice. Patient privacy also extends to the conversations you have outside the practice. Even if you're not identifying the patient, it's not acceptable or professional to discuss patients outside the practice. On occasion, you may come across patients you know personally, and in certain cases it may be more appropriate that another person deals with that patient. In the situation where you're phoning a patient and another person answers the call, never disclose sensitive information to the person without prior authorisation by the patient. If you are required to leave a message on an answering machine, be sure you're familiar with the practice's policy with regards to the content of your message, as it may be listened to by a third party. If a patient requests to view their medical history or would like to transfer their file to another provider, this is their right under privacy law. However, make sure that you follow the practice's procedures for this and ensure that the patient completes the request form and the request is authorised by the GP. Never pass over information to patients about their medical history without prior authorisation by the patient's GP. It's important that you have a clear understanding of the communication systems in the practice. How do messages get to your clinical team? Do you have a paper-based message system or do you use your computer software? Make sure you understand what information you're required to collect when taking messages. Many doctors like their staff to take a comprehensive message, particularly from a patient wanting a return phone call. This can be useful as in some instances the information you collect can assist the GP to make the decision that a consultation is necessary. For example, a patient ringing to discuss worsening symptoms or symptoms that have not responded to treatment may prompt the GP to ask you to call the patient and get them to come in for review. And this can be really time efficient for the GP. You need to be aware of which clinical staff are working and who is on leave to ensure important messages do not sit for hours, days or weeks without someone attending to them. When clinical staff are on leave, the practice needs to ensure that someone else is attending to the clinical issues that arise in their absence. The practice needs to have an accepted protocol for dealing with telephone calls and which calls can be directly put through to the GP and which need to have a message taken. Generally, GPs will take calls from other GPs, specialists and pharmacies, in addition to urgent phone calls from patients. Check what the protocol is in your practice. Patient health records. Maintaining an accurate patient database is important in the event of an emergency and the need to contact the patient, their next of kin or their emergency contact person. Reception staff have a pivotal role in ensuring that all aspects of the patient's profile are current when the patient makes contact with the practice, whether by phone or in person. RACGP Standards 5th edition, criterion C6.1, patient identification, requires that we identify patients using 3 approved identifiers to confirm their identity at each time they attend or call the practice. The approved identifiers most commonly used in general practice include the patient's full name, date of birth and address. Other approved identifiers include the file number, if used by your practice, and gender, as identified by the patient. And note that a Medicare number is not an approved identifier. When speaking with patients at reception or over the telephone, always ask the patient to state their name, date of birth and address to confirm their details rather than offering the details yourself. If there are language barriers or hearing issues, the patient may often reply yes to your question. However, the reality is that they've not heard or understood what you are asking. If a patient's concerned about providing details verbally at the front desk, you can ask for a driver's licence or they can write their details down. Maintaining an accurate patient database is important as it assists with maintaining the confidentiality of the patient's health record because we're confirming that the correct patient is booked for an appointment and the correct record is being opened. Often alerts or notes are placed on a patient's profile requiring follow-up at their next appointment. It's important that these are acted upon, especially in the event that the practice needs to contact the patient to inform them of an urgent appointment or test result. And it's just as important to delete these notes when they've been acted upon. If we're consistently trying to follow up on issues that have already been dealt with, we'll stop following up on them, and that's where things get missed. Practices often use their patient database to search for patients who may benefit from a range of targeted health initiatives, including health assessments, chronic disease management or immunisation. Accurate data helps to identify these patient groups. You may be required to take a role in the practice's recall or reminder system. Recalls are very different from reminders, and it's important that you understand the difference. A recall of a patient occurs when the patient requires further advice or treatment in relation to a clinically significant issue. Often this is due to the doctor receiving test results for a patient that need to be followed up. You may be asked to contact the patient to make a recall appointment. Make sure you know your practice's policy regarding recalls, including how many attempts need to be made to contact a patient, how to document those attempts, and at what stage you would let the GP know if you're having difficulty making contact with the patient. In some practices, this task is undertaken by nursing staff or the doctors may contact the patients themselves. It's best practice for these types of appointments to be identified in your appointment system so that you can alert the clinical staff if a patient cancels or fails to attend their recall appointment. Recalling patients is an issue that involves considerable risk. If a patient does not attend for follow-up of an important result and subsequently does not receive treatment, this is potentially a disastrous situation for the patient. and the doctor in this situation may be liable to litigation. So it's particularly important that you understand the practice's policy and processes, including your role, if any, in regard to recalls and reminders. A reminder does not command the level of urgency of a recall, and it's the contact we make with a patient to ask them to attend for routine care, like an immunisation, health assessment or a routine cervical screening test. The level of effort taken to get a response from the patient who's been sent a reminder is determined by practice policy, but it can be as little as one contact. Creating a safe working environment for staff and patients is everyone's responsibility and critical to the organisation's functioning. Occupational health and safety legislation requires practices to provide a suitable and safe working environment and facilities for staff and patients. Maintenance of equipment safeguards the practice and patients by ensuring all equipment, be it medical or technical, is functioning well and is capable of performing the job that it's designed to do. It may not be your responsibility to organise maintenance, but it's everyone's responsibility to make sure that faulty equipment or hazards are identified and the responsible person's been informed. The reception staff can play an important role in ensuring that the practice is safe for both patients and staff. For example, as you enter the practice in the morning, make sure the waiting room is clean, chairs are safe for patients to sit on, that there's no obstructions in the entrance, and any spills are promptly cleaned and wet floor signage is displayed. Make sure there's no wires or boxes lying around interfering with the walkways and creating tripping hazards. How we manage patients displaying difficult and challenging behaviour is part of making sure the workplace is a safe environment. Staff need to feel confident and supported in these situations. To assist practices to manage difficult situations, it's crucial that staff are trained appropriately and feel confident to deal with a challenging scenario. Practices can display a zero tolerance poster in the waiting room to inform patients that inappropriate behaviour will not be tolerated in the practice, and the staff and patients' safety is paramount. Your practice policy should be clear on scenarios that require you to call the police. This is a very big topic in itself, and I recommend that you watch the webinar on safety in general practice available on the Victorian and Tasmanian PHN Alliance website. Another important part of occupational health and safety is how we deal with an incident after the event. Incident reporting and review is an integral part of risk management, and all staff need to report any incident that occurs. Incidents may relate to an accident or injury or potential injury to a staff member, or relate to a patient or visitor to the practice. All incidents should be discussed in practice meetings, ensuring confidentiality of the participants is maintained when necessary, and an assessment can be made of each incident considering the following points. What was the cause of the incident? Was the incident well managed? Could we have done anything differently? Do we need to review our procedures? Is additional training required? Is additional equipment required? Reporting and learning from our mistakes or incidents works best when it's done in an atmosphere of no blame and always with quality improvement in mind. A really important aspect of working in a general practice is working together as a team. Teamwork has been defined as the process of working collaboratively with a group of people in order to achieve a common goal. Getting people to work cohesively and productively together can be challenging. However, there are so many benefits coming from good teamwork. Let's have a look at some of them now. Increased efficiency. When working in a team, you're working towards a common goal or set of objectives. The whole process of your work becomes more efficient. For example, if there's a problem faced along the way, there are more hands on deck to help solve the issue. It's a learning experience. Listen to other team members' experiences and share your own. Learning from the team brings all your collective experience to complement the work. Projects which involve teamwork serve as an opportunity for professional development and learning. This may be a conscious learning during a meeting, or learning which occurs without you even realising while listening to others. This allows your own skills and capabilities to grow. Enhanced communication. Good communication among team members is an essential ingredient for quality teamwork. Try to involve all key people in important discussions. As a receptionist, particularly if you're new, you may be hesitant to contribute to the team discussions. The best teams are those that value all opinions and where all ideas are welcome. A fresh set of eyes often sees things more clearly than someone who's been in the practice for years. Share the workload. Help out your co-workers when you've finished your tasks. Remember, you're all working towards a common goal. When working in a team towards a common goal, the workload is shared among all team members. In a perfect scenario, this work should be shared equally and be distributed according to the strengths of each member. And finally, good teamwork offers us a support network. Be a supportive and reliable team member. This helps to contribute to a sense of belonging in a workplace and can contribute greatly to job satisfaction. A strong team environment can act as a great support mechanism for staff members. Group members will help each other, rely on each other and build trust within the group. During challenging times, support is crucial for the success of any activity. When members are able to look to one another for guidance or support, focus can remain on the overall goal. If a challenge is handled individually, you're at risk of becoming overwhelmed and making irrational decisions. It's important for you to use the support network in your practice. Ask for help if you're unsure. If there are elements of the job that you're uncertain about, check if there's any training or reading you can do to enhance your skills. Watch your teammates and learn from their experience and give feedback when you can. Telling a more senior member of staff, "I really like the way you did that, I'm going to try that myself," validates your teammate and contributes to an open and harmonious workplace. Remember, your team includes all of the staff in the practice, both clinical and non-clinical. What can you do to help out your teammates? Think back to our discussion on customer service. Remember that other team members are customers as well. These internal customers need to be considered in relation to all those aspects of customer service we discussed earlier. Your attitude to them also needs to be attentive, friendly and helpful. We've covered a lot of different topics today, and this is aimed to give you an overview of the scope of your role in general practice. Reflect on the list on the screen and make a note of the areas you think you may need further information or clarification on. Do you need to learn more about the topic, or do you need to understand how this is managed in your practice? As I've mentioned, there are a range of training packages available that can give you more detail and a deeper understanding of many of these topics, including infection prevention and control, triage, vaccine and cold chain management, recalls, and safety in general practice. There is a link on the screen to the Victorian and Tasmanian PHN Alliance website that hosts these webinars. In addition, your practice policy and procedure manual can be a great reference for how issues are managed in your practice. Never be afraid to ask questions and clarify issues when you're unsure how to proceed. Receptionists play an important role in the health journey of the patient from the moment an appointment is made, when the patient arrives to the appointment, to the time the patient leaves the practice and until they come again. Remember that patients are the focus of your practice, and knowing that you're putting in the extra effort to meet their needs will be appreciated both by your patients and your employer. Working in general practice can be a satisfying and rewarding role for the receptionist. Many practice managers started their career behind the reception desk, so I encourage you to take the broadest view possible of your role. Learn as much as you can about as many aspects of the practice as you can. Undertake any training offered to you, and hopefully you'll see this role as the start of a career and not just a job.